Hi there! Today we're going to talk about Depo-progesterone, also known as Depo-provera, and how it can help with a condition called polycystic ovarian syndrome, or PCOS. Depo-progesterone is a type of medicine that helps balance hormones in the body. It is often used as birth control and can protect the lining of your uterus. To understand how it works, let's first talk about the menstrual cycle, or period cycle. In a normal menstrual cycle, your body goes through a few stages. Here's how it works. Follicular phase. This is when your period starts, and a hormone called FSH, or follicle stimulating hormone, helps eggs in your ovaries start to grow. Ovulation. In the middle of your cycle, another hormone, LH, or luteinizing hormone, signals one egg to leave the ovary. This is called ovulation. Luteal phase. After ovulation, the empty follicle releases a hormone called progesterone to get the uterus ready in case of pregnancy. Menstruation. If the egg isn't fertilized, progesterone levels drop, causing the uterus lining to shed. This is your period. Now let's talk about PCOS. With PCOS, the ovaries don't release eggs regularly. This causes hormone imbalances. Please check out other comics to understand why this happens in PCOS. This can make periods irregular or even stop altogether. This is where Depo-progesterone can help. It provides steady progesterone to help balance things out. Here's how. Endometrial stabilization. It keeps the uterus lining thin and steady, so bleeding is less heavy and more predictable. Inducing withdrawal bleeding. Depo-progesterone mimics the luteal phase. When levels drop, it signals the body to shed the lining, causing a period-like bleed. Cycle regularity. Depo-progesterone can thin the uterus lining so much that some people won't get a period at all. This is helpful for those who want to avoid heavy or irregular bleeding. Depo-progesterone has some key benefits. Predictable bleeding. It helps make periods more regular and easier to manage. Protection for the uterus. By helping the uterus shed its lining, it lowers the risk of issues that can happen when the lining gets too thick. Relief from PCOS symptoms. Depo-progesterone can also help reduce pain and heavy bleeding linked to PCOS. Depo-progesterone is usually given as an injection every 3 months. It's important to have regular checkups with your doctor to make sure it's working well. Depo-progesterone isn't recommended if you've had breast cancer, blood clots, liver disease, or unexplained bleeding. Please talk to your doctor to discuss more on this. There is about 1 to 10% chance of gaining weight or having a headache, and less than 1% chance of mood changes. If you need more information, please discuss with your doctor. In short, Depo-progesterone helps people with PCOS by keeping progesterone levels steady, which makes the uterus lining stable and can help with heavy or irregular periods.